Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Glad that you could join us for another segment. A COVID-19 patient who had trouble breathing and was terrified of being hospitalized is now helping other coronavirus patients breathe much easier. Dr. Matthew Putman is here to tell us more about his, extraordinary story. Welcome to the program, Dr. Putman, and thank you so much for taking the time today.
Oh, it's great to be on. Thank you.
Give our listeners a bit of your background. What is your area of expertise?
Well, first of all, yes, I'm not a physician. Okay. I am an applied physicist, and I'm the CEO and founder of a technology company that does artificial intelligence called Nanotronics. Now, Nanotronics bringing new types of medical equipment to the world in a group called Nanotronics Health.
Now, you contracted COVID-19, is that correct?
I did early March, so I was very early in this, and really wanted to find a way of treating this that would keep me out of the hospital, out of some of the dangers associated with going to crowded ICUs in a city that was, really overwhelmed with COVID patients.
You took drastic measures to keep from being hospitalized, especially in the early days of this pandemic when we knew it less than we know now, and we don't know a lot.
Right.
What were some of those challenges in the early days, trying not to be hospitalized when so many others were being hospitalized?
So I was lucky in one sense. I measured my blood oxygen level using a pulse oximeter. So I was able to see when my blood oxygen level got to a dangerous point that was near hypoxia. And when I did that, I used a really common sleep apnea tool called a CPAP in order to, monitor and raise my blood oxygen level to a point that was healthy. So when that happened, it made me realize that this is something that there's no reason why I should be doing alone, but is something that should be accessible to everybody at a good price. So we set about inventing a way of creating devices that would give everybody comfort in the home to not get to a hospital in the same way that I was lucky not to.
Well, I understand how a CPAP works, but how did you convert a CPAP into another type of device for the COVID-19 symptoms?
Well, we created our own. We're lucky to have a company that works to optimize manufacturing in order to bring down prices of things. So we started from scratch and created a bilevel PAP device so that a doctor, a physician could more closely control the inhalation and exhalation, which was, I think, more appropriate to respiratory distress. And we did this then for a tenth of the cost that this was our goal, is to get a tenth of a cost of what a normal hospital would pay for these devices, and to bring these not only to hospitals but also to make sure they reached the home.
Now, I am not intimately familiar with how these devices work, but I do understand that there are lots of controls, buttons. It's very hands-on. Is this a simpler to use device? Is it one touch, one switch? How does that actually improve upon the current designs?
Well, that was really important to us, is that when somebody is scared in respiratory distress, the last thing they want to do is go through setting up a device. So it is, it's one button, one dial. A physician can set it up so that it's specific to that patient for some extra features. But when a patient is using this, it is just on and off and a simple turn of the simple turn of a knob. So that is as important to us in some ways as the price. It's really bringing comfort to people is important, both comfort that if they were to contract COVID, they would be able to treat it this way, but comfort once they are breathing.
This is something, as you say, can actually keep you out of the hospital if used properly, right?
Yeah. I mean, there are certain levels that I wouldn't want to make too many medical claims. Okay, however, the NIH issued a report, JAMA issued a report that this is a good way to treat COVID and other respiratory distress before it reaches certain critical levels. So whether you go to a hospital, they prescribe this and use it and send it you home with it as a discharge device and free up ICU beds, or whether it's prescribed by a doctor, this is a great alternative to being able to treat respiratory distress. We partnered with the largest healthcare network in New York, Northwell Hospitals, where we learned a lot. We've also worked with other research institutions throughout the United States. But now we're working with distributors in the United States and in 16 other countries. You can find out about it at our website, nanotronicshealth.com. We would like to make this clearly available during this time of incredible need in all markets in the United States.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Matthew Putman. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/healthprofessionalradio.